Well, Dr. Foley, let me just give you a chance to respond to what you just heard.
There is nothing in the rule that prohibits a healthcare provider from giving the full range of information about all the options, including everything you just said. There is nothing that prohibits them from giving all of that information to their clients.
Actually reclaiming my time, Doctor. Now, it was also asserted that the rule creates barriers to care. Can you address that?
The new rule,
The new rule.
that the barriers to care that it may create, there are many providers that avoid being a part of the Title X program because of the current regulation that states that they are required to refer for abortion and that they're required to have counseling about that. And so there are a number of providers that don't participate as a result of that.
Very well. And I know Mr. Guthrie asked you some questions on the non-directive counseling part, and just to follow up on that a bit, you did say that it was up to the discretion of the client and the provider. Can you clarify that?
The counseling is client-directed based on the questions they're asking and what they have. The non-directive counseling there's instruction that you provide the options, a full discussion of the options that they have, and explain that to them. There is no prohibition on having that conversation.
Now, we also heard that the non-directive counseling was equivalent to a gag rule. Can you address that?
If you were prohibited from counseling about a certain area or prohibited from having that conversation, that would be a gag rule. The fact of the matter is this new rule gives providers, does not prohibit them. In fact, it allows them to have that conversation, whatever conversation they would like to have with their clients.
Well, let me,
will the gentleman yield?
No. The other issue, of course, is co-location. And how is this rule addressing the co-location, commingling aspect?
There is great concern that co-location increases the opportunity for commingling of funds, for fungibility, for use of the funds for infrastructure and other things. That was a significant concern, enough of a concern for the regulation to be changed. What is interesting is that concern was upheld by the number of comments we received showing significant misunderstanding of what the rule actually states, and talking about the need for abortion to be a part of what is covered, and significant confusion not only from commenters but as well as the general public. And so in order to have statutory compliance with integrity, the final rule was engaged in the way that it was.
So let me ask you this. State flexibility and competition don't seem like they've always been given a high priority within the Title X program. How does the new rule aim to increase diversity amongst grant applicants?
Part of the priorities are to look for innovative ways to, again, address areas that are underserved or unserved as a result of the Title X program and funding. So with those changes, that is encouraged, and grantees are encouraged to provide those types of services as they apply for this. Again, this is a competitive grant process, and so part of that competition is looking to see what provides the best coverage and into the areas of priority.
So you noted that the 2019 final rule requires medically necessary referrals, such as referrals for prenatal care for the health of the mother as well as the baby. Was medically necessary care for prenatal care not required under the previous rule?
Right, that is right, it was not required.
So what prompted you to add this portion to this rule?
The idea of medical necessity was very important, particularly with the changing climate that we have seen with increased maternal mortality. And we know that the earlier someone who is pregnant is referred for prenatal care, the more likely they are to have a better outcome, both for them and for the child. And so in that case, that was the reason that this was considered a medical necessity, that they would be referred.
And you may mark me down as being supportive of that change.